Keep It Science presents Behind Every Disease is a Patient. Behind every breakthrough, a scientist. And behind every new treatment, a community.
My experience, I was like very long disease with the
Featured by BBC Radio. Real science, real innovation, real impact. Season 3, Medicine, Rare Disease. You're listening to Keep It Science.
Hello and welcome to Season 3 of Keep It Science. I'm Dr. Elizabeth Kugler, your host of today's episode, Connecting the NHS, the Power of Healthcare Networks. And as healthcare systems continue to navigate the growing demand, workforce pressures and digital transformation, as well as the need for sustainable innovation, we need more and more spaces where different stakeholders can come together, share their knowledge and really learn from each other. And so in today's episode, we'll discuss all of this, as well as the evolving healthcare landscape, emerging trends in the digital health and oncology, and what the healthcare professionals really can expect from some upcoming events, such as Outpatient's Future 2026 and Cancer Care 2026. So today, to actually discuss all of this with us is Sean McLaughlin, the director of the Convenzis Group Limited, one of the UK's leading healthcare events organisers. And Convenzis brings together NHS leaders, clinicians, transformation teams, industry partners, and many more to discuss all of these pressing challenges that healthcare faces today. So hello and welcome, Sean. It's lovely to have you here today. Maybe you can introduce yourself as well as Convenzis a little bit more to our listeners.
Good afternoon. Yeah, an absolute pleasure to be involved and to be here today. So just to give you a little bit of context, I don't come from a clinical background myself. My perspective today comes from the production of NHS conferences, and I spend a huge amount of my time speaking to clinicians, operational leaders, digital teams, transformation leaders about what they're dealing with on a day-to-day basis and what we and they can learn from each other. Convenzis as an organisation, I suppose at its simplest form, we spend a lot of time, as mentioned, speaking with NHS leaders about their issues, what they're dealing with, their challenges and how they've overcome said challenges. And we bring those networks into one room together to discuss best practice and really kind of push forward, really. There's a lot of negative press around the NHS consistently, but we really do focus on the best practice and the positive messages, which there is far more of than negative. So yeah, that's me and that's the organisation I represent, and yeah, happy to be here.
It's lovely to have you, Sean. And I think that's also the thing. It's very easy to kind of have negative press about things that people can't control. But actually, I love that Convenzis is doing something that they can control, namely bring together important people and have these discussions. And so that's the change that we love to see here at Keep It Science. And so I think what's always really, really nice is to get a broad overview about what you're really doing. And so you already introduced yourself as well as Convenzis a little bit. But maybe you can also talk with us about like the current landscape. We mentioned NHS, very tricky in some points, but I think especially NHS conferences and having these network environments is really important to be incubators for discussions and exchange. And obviously this has also changed in the past decade, thinking about COVID, etc. So maybe you can share a few kind of insights about, the general landscape.
Absolutely. Yeah, as you mentioned there, the kind of conference and events ecosystem has changed dramatically over the last couple of years. Events historically have always kind of been, more presentation led, speakers on the stage, audience just listening, lots of policy, lots of strategy. And now people want practical learning, what's worked for one trust. How has that actually been done though? What didn't work, more importantly, some of the challenges they had as an individual person or as an individual trust, and how they overcame that, and how they worked with governing bodies and partners and surrounding supporting to be able to kind of push forward and get those problems rectified. How can I take it back to my organisation is something, what can I take back from my organisation from a conference is huge for us, and huge within that kind of conference ecosystem now as well. We don't just need to be talking about how amazing a service is. Okay, well, how did you get into a position to be amazing? How did you write a business case? How did you get the funding? This kind of thing. So we've moved into a skills exchange model of conferencing, and that's worked really well. So yeah, it's more about practical learning now, as we've moved from, as you say there, COVID has just completely changed expectations. Digital became the normal, but it's also showed the value of meeting people face to face. Relationships and peer learning really, really matter now. So yeah, we've seen a huge change over the years. The conferences that we develop now are far more skill exchange and deep dive sessions, for example. So as you mentioned there, we will be discussing the how, not just the how we got there. It's the how we do it now and how we move that forward and how we liaise with other people. So there's a lot of lessons learned, a lot of case studies, a lot of discussion based around here is what the future should look like, and here's how we're actually delivering it. So yeah. I suppose for us, the biggest shift has probably been from information sharing to implementation sharing, if I was to summarize it into a line.
Love that. I love that. And I think that's also the important thing. You always need this room for discussions. And I always find if you go to a conference or trade show, you get information from just attending presentations, but actually the kind of troubleshooting and the practical insights and the skills inside is actually in the networking sessions or when you talk to people. So I really absolutely appreciate that and love that, because it's such an important thing to really exchange and have this room for troubleshooting and kind of getting this, what worked, what didn't work. Because normally you always hear just about the perfect polished story, and it's never like that, right? So I love that. And I think that also is so important because obviously when it goes more towards the skills exchange, you get really good perspective to what some of the hot topics are, especially among NHS leaders at the moment. So maybe you can share some insights into what's the hot topics at the moment.
Yeah, of course. From the conversations we're having when we build our programs, there are a few kind of main themes that are coming up almost everywhere across the sector at the moment. So we'll go through them now. So demand and capacity, for an example, services are under a huge amount of pressure. How do we handle more demand with, finite resources, basically? Workforce. Now, this isn't anything that we don't know about already. It's all constantly in the news, but, how do we make better use of clinical time? How do we reduce unnecessary admin, which is obviously huge, and that's where digital can really come in? And how do we support staff rather than just asking them to do more? Is a key thing as well. We're all human beings at the end of the day, and historically, a lot of people have probably felt like just a number within a machine rather than a human being. So how do we kind of rectify that issue? Digital and AI goes without saying. Not just AI is exciting, where does it actually improve pathways and how do we integrate it safely is a huge area now. That governance side of things, how do we govern something that's consistently evolving? So that's an interesting area. And then moving care. So, moving care kind of means more care outside of traditional hospital settings. We're looking at community, digital pathways, remote monitoring, and prevention and early intervention is obviously key, which I'm a strong believer in should start in schools, but that's a completely different, separate problem within itself, really. So, from an observation perspective, just to kind of wrap it up into a bit of a line, the interesting thing is that these aren't separate conversations anymore. Workforce, digital, patient flow and access all affect each other. So it's, bringing that conversation in and bringing those separate teams in to really kind of focus on the end goal, which is, of course, improved patient outcomes and, improved life for everybody, really.
Yeah, I love that. It should always come back to the improved life and outcomes for patients. Absolutely. And I think that's often what we also forget, right? Because it's very easy to talk about the NHS or the clinician or the pharmacy or whatever it is and kind of separate patient from actually the system. So it's quite nice to bring that back into it. And I think also you touched on it's more and more important to bring these different groups and stakeholders, such as clinicians and patients and industry partners and all of them into one room, same as, for example, policymakers. Do you see a little bit of a change of who is in the room and why it's so important to also physically bring them into one room?
So as mentioned now, it's not a kind of, we don't have singular problems anymore. We are looking at, I say we, but the NHS is looking at, the real integration of services. So we have to be bringing different voices and different perspectives in, primary care and secondary care, the bridges are really being formed. Things like social care and healthcare, they have got serious, they are seriously disjointed, but that is where the real kind of money is for patients. Pardon the pun, really. It's where the kind of better outcomes are. So yeah, we have to be diverse in an audience, and that does provide really, really high value networking, because just to kind of, give you a bit of a flavor, really. So if you had a room full of finance directors solely, for example, it would make quite dull networking, because they all have the same problems. They all see the same thing on a day-to-day basis, where if you have that diverse room, it really does provide completely different perspective. And that's where, conversations are accelerated and change happens. And it's the same with teams, isn't it? Diverse perspectives, diverse backgrounds has been proven, to be hugely powerful in terms of, gathering perspective and driving initiative forward. So, yeah.
Absolutely. Couldn't agree more. And that was such a beautiful introduction. Thank you so much. Because we are going to join you as media partners at Convenzis. So obviously Keep It Science is produced by Acorn Scientific Marketing and my own company Zeeks, and Zeeks will be joining you at 2 events later this year. And so today we wanted to also talk about 2 events, which is super exciting. One of them is Cancer Care 2026, which is the NHS Oncology Conference, which is on the 6th of October in London. And the day after, on the 7th of October, is Outpatient's Future 2026, the NHS Outpatient Innovation Conference. So also to our listeners, if you have not yet registered, there's still time to do so. Again, the conferences are called Cancer Care 2026 and Outpatient Future 2026. And we will obviously add the links to the description later on as well. But so for the next few minutes, I want to really take some time to speak with you about Cancer Care 2026, Sean, because I think all of us know at least someone who has cancer or have cancer themselves. So cancer obviously touches millions and millions of lives, right? And so I think we can all agree that it's incredibly complex as a disease, but also we need faster diagnoses, more accessible treatment, and a workforce that is really confident in delivering kind of the change of care that we're seeing at the moment, different treatments and how we bring them to the patient. And so it would be really good to talk with you about some of the major developments that are driving the change in oncology services.
Of course. So I won't try and explain the science. I'll definitely leave that to, the clinical details to the oncology specialists that we work with. But from building the cancer care program, there are several themes that we can kind of go through and that are coming up quite strongly across the board. So I would say, kind of 4 main areas, really. So the word earlier detection, targeted screening, personalised. So, for example, we're looking at kind of genomics and more personalised treatment, which is super exciting at the moment. Technology, of course, so AI, liquid biopsies, genome sequencing and cancer vaccines, which again is just super exciting. I mean, cancer vaccines is such an exciting thought in itself, and genome sequencing, which does sound, well, it is very in depth, but nonetheless, it's providing that kind of personalized treatment for an individual, because we're all different and we're all made up differently as well. So, and then closer would be the 4th word I would pick there. So, more diagnostics, monitoring, rehabilitation, and follow-ups closer to home. Is key, and all 4 are directly, reflected in that cancer care program we've developed. So for us, just to kind of summarise, the really interesting question isn't just whether these innovations exist; it's how the NHS actually embeds them into routine services safely, and at scale, which is its own problem, but super exciting time for the sector in particular, and a lot of best practice and a lot of amazing, exciting things going on for families and patients suffering from cancer. So there is a lot of light at the end of the tunnels now.
Which is amazing, because you mentioned a few words such as faster, technology, precise, individualized. It's all really, really great. But maybe we can also have a sentence or 2 on closer, because that's something that I find really interesting, this closer to home. Because so I'm from Europe, and then I moved to the UK. And one thing that really struck me is obviously that some of the specialist centres are really kind of very concentrated. So patients who maybe are in a more rural area need to drive 2, 3, 4 hours to a treatment, right? Then they maybe have treatment for 8 hours and then they need to drive back home, which is really, really difficult. So maybe could you speak a few words on like closer and like how this looks like at the moment?
Yeah, so of course, like you mentioned there, it's really difficult. We do have specialised treatment centres, but they are not in every town and city in the country. So at the conference in particular, we do bring those specialised treatment centres to the conference. They can discuss and hopefully kind of accelerate others doing this type of thing. Neighbourhood health and earlier diagnosis is a key, so we are leaning heavily on AI to get that early diagnosis, and then that pathway begins nice and early, and hopefully treatment can begin, and ultimately, it stops that pathway nice and quick. So it's its own problem in a way. It's a huge problem that the NHS is trying to rectify, but they are putting a lot of resources, and a lot of budget into getting people treated closer to home. And as we're starting to see, we have these exemplar pilots, so for example, the Christies, as their best practices kind of broadened out, we will start seeing these other areas pop up across the country. And personalised care is something I'll revert back to as well, because we're able to start seeing now through data and analytics, certain demographics in certain areas will have a heightened need for a certain service, for example, which is quite interesting, whether that be, conditions in their living, it can be local factories around them, it can be local, geographical locations. It can have a different impact on those communities. So we're starting to kind of look at those areas, and then we will be putting, specialised treatment centres based on services within those areas that need them based on data, not just because we think it's something people might need in the area, it's because we know it's what people need in the area as well. So.
Absolutely. That was also something when I moved to the UK and moved to Yorkshire, I was quite not stunned, but probably surprised by the fact that there's like a regional higher incidence for cancer, which I'd never even thought about, right? But because it's like in a valley and the air gets trapped, etc., there's a higher incidence. And so that's super interesting. I find that absolutely, mind-boggling, really.
It is.
So for someone who is attending Cancer Care 2026, can you maybe share some of the points that will be the centre of discussions and what they can look forward to?
Yeah, of course. So we're not just going to be talking about kind of, I suppose cancer it's not just one department. So we're going to be literally talking through patient journey from primary care to screening and referral, and then to diagnosis, and then imaging and pathology. And then we're going to be looking at genomics, and then oncology treatments, and then kind of follow-ups within the community. So what we like to provide at the conferences is a kind of a journey through the conference, as if a patient was going through that journey. We highlight that patient journey at the conference, but from a guest speaker, from a sector perspective. So what people can expect is a full journey of a patient, but through the eyes of a service and through the eyes of a clinician, and then focusing on those key points throughout each of those areas to make sure that we are, providing not just a why it's needed, but a how we are going to tackle that, and how people are doing that already, and what people can take away straight away from the presentations and implement into their services. So I would say, if anybody is interested, obviously, if anyone's already working in the oncology space, and anyone is just passionate about driving this agenda forward, which we all should be theoretically, then it's going to be a really worthwhile and valuable conference to be involved in. So it gives you that wraparound 360-degree view of a patient's life cycle, but again, from that kind of system level and clinical perspective.
I love that. I really look forward to that, because I think a patient journey is so unique, especially not just to the patient, but also depending on diagnosis. So for example, an oncology patient, their journey might look completely different to someone in rheumatology or someone in GI. It can be really different. So I think even putting together a conference like that means that you guys really understand how to navigate this whole system, right?
Yeah, it's quite complex, and I suppose, like you say, we've got a couple of kind of key areas, and I can touch base on some of the speakers briefly. But finding cancer earlier, more personalised care, actually getting innovation into pathways. So we've got Jessica Curtis, who's the NHS Cancer Vaccine Launchpad. She's going to be getting involved and talking about, how this cancer vaccine is progressing. And again, that's, for me personally, something unbelievable to even comprehend, that we could have some sort of, vaccine-based therapeutic that will be able to kind of prevent people from even contracting cancer in the first place. That's going to be amazing. And we've got Majid Kazmi talking about using digital technology to optimize cancer multidisciplinary working, which again is super, super timely and super relevant. And we've got a fair few conversations taking place across the day that are just really at the cutting edge of that, service overhaul. What I like about the programme is that we're not just talking about the exciting developments in cancer, though. We're just asking how you can actually implement them. It's all well and good saying, well, this is the art of the possible, but it's like, okay, great. How do we do it? And that's what we're focused on.
I very much look forward to this. Same as I look forward to the next day, which is Outpatient Futures 2026. And this doesn't focus on oncology, but actually on outpatient care. And obviously, this is something that, we see across the board, but also probably especially in the NHS, that we kind of need to shift from hospital-centered models to really kind of how we can serve the community. And we kind of briefly touched on it with kind of this closer, how can we bring services to the community? But also, obviously, that's not as simple as just saying we bring nurses out, but actually it needs a whole integrated and digitally enabled community services. There's a lot of different layers that fall into this, but maybe you can really talk with us about what does it mean, and what does it mean in terms of like NHS innovation, like in actual terms, not just in the theory, but in practice.
Of course. Almost every hospital, almost every hospital speciality has outpatient activity. So improvements here can be absolutely massive. So the traditional models is historically we thought quite heavily in terms of appointments. Patient comes into hospital, sees somebody and goes home, but not everybody needs that model. So we're looking at, some people need a face-to-face specialist care. Others might need, others might be better served through digital follow-ups, community care, remote monitoring, patient-initiated follow-up, better triage. So the big impact areas here are, if you get it right, are, better access to care, better patient experience, fewer unnecessary appointments, which again is really, really chipping away at that demand and capacity piece, which we talked about a little bit earlier in terms of a key theme for the whole NHS, and clinical time being released, which again, demand and capacity, that human centre we were talking about is staff are actually humans, they are families, they're not just robots. So really being able to give clinicians time back, ultimately to them as humans, but ultimately to be able to, focus on, their patients as well, rather than just the admin side. And then, the supporting of elective recovery, which is obviously key on this particular agenda as well. So this is exactly kind of what we're talking about at the outpatients conference, and it's what it's built around really. So as a kind of wrap up really of that, a bit of a summary, it's not really about replacing appointments with technology. It's about making sure that the patient gets the right type of care in the right place at the right time, and looking at, a multitude of different ways of doing that.
Yeah, which is really, really difficult because, like you say, there's multiple things, especially also, again, the access. And then some patients might prefer like an app and others might prefer a letter, but it's very different and very individualized. And also, for example, with apps, sometimes they don't work. Letters sometimes might get lost. Nothing is foolproof, unfortunately. But what I love is like you touched on a few of these pressures of like, there's so much that kind of needs to be considered in this, but especially I think for also outpatient services. Are there some of the key themes that you maybe could dig a little bit deeper into? Like, what's the key pressures that we see with outpatients?
Yeah, of course. A lot of these do, a lot of the pressures which I'll go through now kind of do reflect onto where the NHS is at as a whole system. So demand, more people are needing services. That is not, it's not something that any of us, it's not new to any of us. It's something we're all very aware of, again, through the media. It does focus quite heavily on, more people needing services and how we're going to kind of focus on that demand. Waiting, that's where that elective backlog and access comes in. People are waiting quite a substantial amount of time. I think we're still looking at, backlogs in treatment in some areas and some silos from COVID, which is quite shocking to even think about. admin and workforce. Naturally, as we talked about, limited capacity and huge pressure on staff. So it's how we lean on personalised care and technology to really be able to give time back to the workforce. As mentioned, not just for them to be able to crack on to the next patient, but for them to be able to actually, live and be happy within their role, which of course will improve outcomes as we go forward as well. Communication as well is a huge area. So, DNAs and patient communication, navigating pathways. I mean, people not attending appointments is huge. So what are we missing there on that communication side? What can we do to mitigate that? And again, that will really help with that demand and capacity piece and the workforce piece as well, because naturally a missed appointment could have been someone being treated, and the list goes on. And again, the key theme and the buzzword is digital. Lots of technology exists, but it has to actually connect and work properly. And that is it's a hell of a job. Let's put it that way. One thing that comes through strongly is that simply, digitizing an efficient pathway doesn't necessarily solve the problem. Sometimes you need to redesign the pathway first, and then obviously, bring your digital in around that, base it around that new pathway. This is, again, very consistent with the event program. The emphasis on referral optimization and patient communication and digital workflows and redesigning care pathways. So yeah,
I love that so much. There's so many different points that we could really dig into a little bit more, but I think the buzzword, as you said, is digital and bringing everything together. And like you say, it's so difficult, because even if we think just about systems in the UK now, like, do not resuscitate, lasting powers of attorney, you have a GP app, maybe you have an NHS app, you have different trusts, you have different specialist centres, and just bringing this together is such a huge challenge, right? It's like, oh my God, how do you even handle that? And then the fact that if you go into hospital, most of the time, nurses still work on printouts, fill in like with hand, need to scan that again, but still keep the paper copy. And it's all like these different layers of, chaos.
Yeah.
So I really look forward to this conference and to these different themes, especially the digitalization. But maybe you can also share with us, in addition to these wonderful themes, who are the speakers that we can look forward to?
Yeah, so we've got some amazing speakers. One that really excites me the most is Ian Erdley. He's National Clinical Director for Elective Care. He's opening the conference up and he's looking at kind of patient transformation, elective recovery, and how it fits into that wider direction for the NHS. So his keynote is specifically going to be covering pathway redesign, digital, virtual care and demand and capacity, but from a national perspective. So that is kind of the opening, and that is one that's really exciting me, because it's so politically current, and it's so it's so encompassing of all those areas we just discussed within one 20-minute session. So I'm excited for that. That's going to be opening up. And another one that I would like to mention as well is Erica White. Erica is the Programme Director for Digital Enablement from Outpatient Transformations in Mid and South Essex Foundation Trust. Now, Erica is, we've got a session primed beyond the clinic, from appointments to digital pathways. And this is going to be looking at AI embedded communication, automation, digital PIFU. We've got intelligent scheduling and moving away from purely appointment-led care. So again, within those two sessions, ultimately, you've got that whole ecosystem that we've just touched base on within two sessions, and then we've got a plethora of other presentations taking place throughout the day, which really go into the nitty-gritty and the deep dives of how these things are being implemented. But I'd say for me, the standout sessions so far are Ian and Erica. So yeah, two really good ones there.
It sounds like just Ian and Erica sessions could feel like 2 days in themselves.
100%.
So lovely. Yes. So we need to talk fast, discuss faster, and make lots of notes. That sounds great. I love that. And I think that's the thing. I think there's, so many things that we could, again, critique in the NHS. It's very easy, like I said at the very start, to be kind of negative, and we know that there are issues, but again, I think the nice thing is that conferences like this are really trying towards a positive development and kind of something, changing towards the better. So maybe we can also end on a positive note. So for you personally, is there maybe a particular innovation, a project, or kind of an individual that inspires you?
That's an interesting question. I wouldn't want to pick an individual because I'm speaking with different really influential and inspiring people on a day-to-day basis. So I won't want to call one person out and leave 100 others behind. But in terms of a kind of a project that's inspiring me at the moment, I would say that one area that I do find really interesting is how technology can remove unnecessary steps from a patient's journey. For example, obviously I've got aging family members, and to be able to simplify, when I just look through it as through my grandma's eyes, to be able to simplify my grandma's journey. She's a very anxious woman, and to be able to reduce any of that anxiety, growing old and becoming, slightly less fit, shall we say, and having health worries is scary enough without making the route to care daunting within itself. So for me personally, anything that kind of helps that is really exciting for me, and from the people I'm around and my family members, and something that I can see the impact having straight away. Examples would be obviously AI enabled triaging. These things are done automatically. These things aren't done from multiple appointment stages or anything like that. Automation, automated communication, again, keeping things nice and easy, nice and simple, and giving the information to the proposed patient where they want it and how they want it is key. Again, my grandma, bless her, is super anxious, so she would benefit from having information received in how she would like to. She's got a little iPad, so I think the information through that would be great, rather than having to go to an appointment and we shouldn't know what's going to happen at the appointment. Is it going to be good news? Is it going to be bad news? So she'd like the band-aid ripping off, as it were. We're all, majority of us are the same. Digital follow-ups and remote monitoring, super exciting, and patient access platforms as well. Our elderly family members are being kind of forced to become more digital as they go forward. So it's, again, how do we help them onboard them into this new world we live in, and make sure they're feeling comfortable and happy with the way they're receiving information. So what interests me is technology that gives time back to staff as well, and makes patients' journey more simple. Basically, that's much more meaningful to me than technology for technology's sake.
Shout out to your grandma, first of all. Yes.
Barbara,
awesome.
yeah, big Barbara.
Barbara, yes, shout out to Barbara. Love that. But I think we can all understand that. So we actually kind of started this season now with your episode as we ended season 2. So season 2, we really focused on rare disease, and we spoke to different clinicians and funders and patients, etc. And I think the themes that you mentioned today with access, digitalization, speed, quality of life, quality of care, etc., they are so important. And so I'm myself a chronic illness patient, and I can only tell you from my experience, navigating healthcare is battlefield. It's like you don't know who to ring for what, no one's responsible, what's centralized care, where do you get medication? It's all a bit of a battlefield. So yes, I'm with Barbara. Totally get her.
Yeah,
yes. And like you say, yeah, it's absolutely, it's also like before an appointment, you never know what actually happens. So bringing together data is really important. And actually that's kind of what we ended on in season 2 with Jason Millard, who we spoke to about autoimmune, which is trying to bring together different data and kind of information into an app. So very interesting that everything kind of links together like this. So I think that's kind of everything that we wanted to speak about today, but is there anything that you would like to add, Sean?
Not at all. I'm just, as mentioned, honoured to kind of be involved, and if I could kind of, provide any message to people that it's, don't always listen to the media. There is, for every one piece of bad press and one piece of bad information about the NHS and our health service, there is 10 pieces of amazing best practice and amazing work going on. So as individuals, do have trust and have faith in our system. It is working, and there's some amazing work going on, and ultimately it's just going to benefit us all and our families.
Positive. Great last note. Thank you so much. Thank you for joining us today at Keep It Science. So this was Sean McLaughlin from Convenzis Group for sharing all your insights and challenges and opportunities that we face today in healthcare. So thank you, first of all. It was lovely to have you.
Absolute pleasure.
And so today's conversation is really a great sum up and kind of introduction to this next season, where we again talk with different clinicians, patients, researchers, technology providers, and healthcare leaders. And this is everything that we can expect from the events Outpatients Future 2026 and Cancer Care 2026. Again, they will be organised by the Convenzis Group, and the website is convenzis.co.uk. We will make sure to add the link in the description. But to our listeners, if you enjoyed the episode, as always, please make sure to subscribe and share it with others. And so thank you for joining us. Until next time, and keep it science.
Thank you for listening to Keep It Science. Make sure to like and subscribe to hear more from this BBC Radio featured podcast, created by two award-winning companies, Acorn Scientific Marketing and Zeke's Art for Geeks.